Hello, and welcome to this week's episode of the Authentic Physician Show, where we have honest conversations about medicine, identity, health transitions, and living the lives that we weren't told how to live. If you're a woman trying to figure it out as you go, you're juggling work, you're caregiving, and you're trying to take care of your health, and your body just isn't responding the way it used to, you are in the right place. Today, I have with me Dr. Sassy Weinstein, and I'd love to welcome you to the show and ask you to invite yourself, introduce yourself to our audience. Tell us a little bit about where you are and what's going on in your neck of the world.
Yeah, awesome. Well, thank you so much for having me on. Really, really excited to be here and finally connect with you. So
Yes.
I am Dr. Sarah, more informally known as Dr. Sassy Weinstein. I'm a primary care sports medicine and lifestyle medicine physician, and I opened my own practice in 2024. So I'm about a year and change in, and just really excited to finally be doing kind of exactly what I love doing and kind of treating patients with the time and care that they deserve and kind of getting back to my why and, why I went into medicine in the first place. So really excited to chat more about it.
I love that. And so sorry I mispronounced your name. I was totally thinking it would be the same as how we pronounce it in St. Louis. So apologies. I should have asked you. Thank you for teaching me.
I
And
respond to anything, so you're all good.
it's a good lesson to learn. So, and a reminder. In terms of all the academic stuff you just said, we're going to get to that in a minute. But let's do something a little bit more fun, I think. Let's tell the audience who you are without the credentials.
Yeah, so I am a mom of two little ones. They are 3 and 4, so pretty close together in age there, and a wife, a friend, an athlete, super avid, person who works out, loves being active, hiker, traveler. So lots of
All the
things
things.
all the things that kind of fill my cup, being outdoors, being close to the mountains, which we don't have so many of in New Jersey. But dreams.
Right, exactly. You have to have ambitions of where you're going. So I
Exactly.
like it. I like it. Very, very cool. And at the time we're recording this, you are surviving a recent snowstorm.
Yes. We were just talking about and how we had to reschedule our first podcast because kids were off school, and we got
Yes.
hammered here in New Jersey with, one of the bigger snowstorms we've had in years. Probably, 16, 17 inches. So kept the kids home from school 2 days in a row, and just just coming off of that long weekend and getting back
Yes.
to kind of what is real life and work life and a little bit of sense of normalcy here.
Yes. Talking to another adult feels good. So,
Feels great. Yeah, feels
right.
great.
Yes, I can relate to that. Well, thanks for sharing that with me. When you were describing that, it made me realize perhaps there's a connection between how active you enjoy being, all the types of, you said you're an athlete. Is that part of the story of how you got into sports medicine, or is there a different reason that you did that?
Yeah, for sure. And I think that if you talk to any probably sports medicine physician and probably a lot of orthopods as well, some part of their backstory is going to be about their own athletic career and injuries or illnesses, or just really maintaining that passion for sports, for athletics, and treating the people that they once were, right? And so kind of
Right,
holding on
exactly.
to a little bit part of their past. And so yes, I was a pretty competitive athlete my whole life. And as I started getting into my high school years, I just dealt with a lot of injuries and illnesses that sidelined me and kept me
Mm,
doing from what I love doing most. And when you are an athlete, it is such a huge part of your identity. And
mm,
when that's taken away, it's just, you have to figure out what that looks like for you. And so I wanted to
yeah.
see people, who were going through the same stuff and, hopefully prevent them from getting injured in the first place, but also being there for them and kind of being able to relate to them with my story as well.
That's beautiful. So thanks for sharing. What sport did you play, or sports?
Yeah, so I played soccer, basketball, and softball. I would say soccer and basketball were my two main sports. I played club
Mhm.
basketball even through college. And now
Okay.
I sort of, after some more injuries, I am sort of retired from the team sport and now just
Yes.
really active, working out and lifting heavy and doing all the stuff that I still
Mhm.
love doing.
Oh, that's fun. My daughter plays club volleyball. She's 13. And of course, I, in my head, think I can keep up with her, right? And let's be clear, I was not an athlete in high school and college. So we're talking a whole different level, right? But it's
Yeah.
always fun when she's like, come on, mom, serve the ball or spike it or whatever. And I do it. And it's like awful, just awful. Like someday she's
Yeah.
going to
She's like,
record me
this
doing
isn't
it.
fun.
Right. And she's like, just stop, mom, just stop.
Yeah. Yeah.
So,
Thanks for trying.
my, I appreciate the interest, but just no. So
Yeah.
I've always been a little bit envious of those who are more naturally athletically inclined. And it's good to see how you're able to take that part of your story and integrate it and weave it into the current day.
Yeah.
Tell us a little bit. One of the reasons I wanted to have you on the show is you're a little bit of a rebel, right? Like me, we're both like, the system isn't working.
Yep.
Bye. And we're creating
Yep.
our own thing. So tell us how that transition happened. For example, did you always know you were going to do it or what happened? What's that story?
Yeah, no, definitely did not always know that I was going to do it. In fact, even when I started my first job at a fellowship, I was like, I can't ever imagine having my own practice. I've got no interest in it. So straight out of fellowship, I started my career at a huge ortho practice,
Okay.
kind of in my local area. So I was one of like very few non-operative sports physicians, just kind of surrounded
Hmm.
by orthopedic surgeons, kind of in my smaller group amongst the bigger practice. And really an amazing way to start. I had known about this group really ever since medical school, where I found my mentor. He's actually still a physician there.
Uh huh.
And I had shadowed there. Really, I knew a lot about it. And honestly, in med school, if you had told me that I was going to be working there at a fellowship, I would have said, I absolutely will not be working there. But it was really an amazing place to start. I was there for 3 years, really great experience, especially coming out of fellowship. You have so much like of imposter syndrome, and
Hmm.
you're just like, oh my gosh, I can't believe I'm my own. And so I was just surrounded
Right.
by colleagues who were so receptive and like answered all my questions. I would just go up and curbside them and be like, can you look at this x-ray? Is this broken?
Hmm.
Make sure
Hmm.
everything is fine. And so they were all an amazing community, all of who I'm actually still very close with. And we kind of still refer back and forth to each other. And
That
then,
is cool.
yeah, it's awesome. And then about three years in, I guess, I was presented with an opportunity to be the sole physician and start the medical side of a multidisciplinary practice,
Hmm.
including PT, OT, chiro, acupuncture. And I was like, this is awesome.
Yeah.
This I think is what my dream is, to kind of have this full scope practice, one stop shop, and just be able to kind of talk to everybody on a daily basis that you are treating, mutual patients, and
Hmm.
just the best thing for the patient themselves. So
Hmm.
I actually joined that group, and it was a little bit different of an experience than I expected. I did not have the autonomy that I expected, and just the vibe and the
That's
environment,
frustrating.
super frustrating. And yeah, the vibe and the environment was just not for me. And I learned that fairly quickly. And so
Mm-hmm.
I kind of was at a crossroads about a few months in when I was there. And I was like,
Hmm.
I know that I can't stay here because
Yes.
it's just actually not good for me,
Hmm.
you know, for my mental health, for like anything else, for my medical practice,
Right.
right? I'm not where I thought that I was going to be. So I can
Hmm.
either go back to the big ortho group, which is safe. I know what to expect. They said they would have me back whenever I wanted to come back. Or I start my own practice and kind of incorporate everything that I've learned thus far and
Hmm.
do exactly what I want to do.
I
So
love that.
obviously chose the latter. And here I am today.
Well, congratulations.
Yeah, thank
And I
you.
imagine, tell me if we're wrong, but having done this similar path myself, even when you get in on your own, you're like, oh, that's how it really works. Well, that's interesting. I didn't expect that, right? So there's this
Yes.
constant like reassessment and how do you have to wear the business owner hat while you're simultaneously wearing the physician hat and make sure that both are aligned toward the patient's benefit. And it's a mix of
Yeah.
challenge.
It's It's wild, I would say. And I mean, you can prepare, but you also can't, right? There
Right.
is just so much learning that happens every
Yes.
single day, especially in the
Uh-huh.
beginning when you are just faced with question after question and just trying to like
Right.
figure things out. And
Yes.
I also like didn't really have a plan when I gave my notice at my
Mhm.
other job. And like I didn't have a space. I didn't have the name of a practice. And so I just knew that, all right, I will figure this out. But I
Yes.
can't be here.
Correct.
So it's okay also, I think, moving on to something when you don't have this like super concrete
Yeah.
plan in place and you'll figure it out. It's going to be hard regardless, right? But
Mhm.
if you are
Absolutely.
motivated to do it, you can
Mhm.
figure anything out.
And that is so true. I don't think you talked about imposter syndrome earlier on, and our audience, of course, comes from all different industries, not just the medical profession. So those are themes that I hear in my exam room from HR, from engineering, from accounting, from legal, right? And it's all of, am I good enough? Who am I to be pretending, etc. And yet, have your own back, man. Take the jump, go in, do it, and see what's the worst literally is you'll fail. And if you do fail,
Yeah,
you'll figure out what to do next, right?
absolutely.
But
Yeah.
the fear factor is there. And so I don't want to take away from it. I had
Yeah.
about 4 months from the time I left one practice to when I started my other, and you're like, okay, this just got really real.
Yes.
And how are we
Yes.
going to make this work? And so
Right.
I hear what
Exactly.
you're saying.
And figuring that all out. And then
Hmm.
even when you do start seeing patients again at your own practice, right? That
Right.
whole imposter syndrome
Uh huh.
starts over all over
Yes.
again. And it's like,
Yes.
oh my gosh, do I remember how to see a patient? Like you forget that you've practiced
Yes.
before,
Do
but
I know how to do the
like,
basics still?
right. Yeah. But it's like, now it's just me and now it's my practice.
Right.
And now this is like,
Nobody's checking off. Yeah.
right. Exactly. So
Uh
yeah,
huh.
it's just, it kind of goes through all these phases that you just get through.
I liked how you said, you don't really know what you're going to do until you get there. And it reminded me that's kind of like being a parent, right? Like you can
Yeah.
tell and read and know about either childbirth or child rearing, right? But until you're actually in the hot seat, just totally different. So
Yeah,
that's
for
what
sure.
I was thinking when you said that. I was like, I feel like this is what I should have been told when I was going to have my first kid. So
Yes.
anyway,
Can't
that's
really
very,
prepare.
very cool. Yeah, you think you are, but you're really not.
Exactly.
I'm not totally sure I'm prepared yet. My oldest is 13, so, still
Yeah.
figuring it out as I go.
Yeah. All different
All
phases.
right. Totally. So I'm curious. I'm thinking about kind of you've got a unique background that perhaps most of our audience doesn't necessarily interact with a sports medicine physician regularly if they're not an athlete or not inclined athletically. So I'm thinking about all the women I see who, their 30s, maybe they have had a kid, maybe they're trying to get pregnant. They want to lose the weight. They've overdone it at the gym, their home, their neighborhood, whatever. When you're trying to recover from something like that, how is the best way would you recommend? There's not necessarily a specific injury, but they've strained something. Something isn't where it should be. Should they go see you right away? Should they just sit and rest? What are your thoughts on that?
Yeah, I love this question because I actually think that there's so many people, kind of even including in the medical world, that don't
Mhm.
know necessarily what primary care sports medicine is. And
Mhm.
it is essentially the way I explain it is I'm a non-surgical orthopedist. So
Yes.
I see, and we know that 90% of injuries, musculoskeletal complaints, are non-surgical in nature. And
Mhm.
so you would probably rather see kind of like a generalist for sports medicine,
Yes.
right? Rather than straight going to like, a shoulder specialist who specializes in
Mhm.
surgery and they're incredible at what they do, but maybe not used
Right.
to seeing as much of kind of the non-operative stuff and they're trained
Mhm.
differently. And
Right.
so I would say my threshold is like if something hurts and you're not sure what to do, always
Mhm.
reach out, right? That's what we are here for. And by doing, a full exam, I use a lot of ultrasound in my practice to help diagnose. I look at biomechanics, I look at kind of strength and core stability and all of that in the office. And a
Mhm.
lot of people also just feel a lot more reassured when they have a diagnosis and then are kind of
Yes.
given this plan almost about
Mhm.
what to
Mhm.
expect, right? Rather than guessing and Googling and chat GPTing and, you know,
Right.
and trying to do that, or just stopping all activity cold turkey, which we know is
Right.
kind of the worst because, right, it's really important for our mental health. And you talk about moms, you talk about postpartum, you talk about, all these other challenges in life. And
Perimenopause. Yeah.
100%. And being active is such a stress reliever. And it's so important for our physical and our mental health that I
Mhm.
rarely ever tell people to totally stop,
Mhm.
any form of movement, because movement is so important. And
Yeah.
pretty much you can modify anything in a way that is comfortable for your body and allows your body to continue healing while loading the tendon appropriately, while also working on the other components of lifestyle medicine, which is kind of how it all gets incorporated, right? Taking care of your nutrition, sleeping well, all of these things are so important for recovery, that we kind of forget about those things. And we're just like, how do I heal this pain? And like, what can
Mhm.
I take? What quick fix can I do? So I
Mhm.
kind of put all of that together and come up with a plan that works for the patient to help them kind of get better. But kind of to answer your question, I would say they can reach out. I would say if they're having pain, right? Why suffer and not know what's happening, right? Rather than kind
Mhm.
of getting educated and knowing what to do about it.
Absolutely. It's always striking to me that people, and I'm going to pick on the two main injuries I see in my clinic, and I'm loosely calling them injuries, but my postpartum moms, a lot of it is the tendonitis of the thumb, the wrist, the forearm from holding the baby, right?
Yeah.
Perimenopause, what I tend to see more is the shoulder, adhesive capsulitis, the frozen shoulder
Yeah.
for our listeners. And so, what strikes me in that, I'm curious your feedback. They'll often wait 2, 4, 6 weeks before they even see me, waiting
Yeah.
for it to get better, using it some. It has good days, bad days, maybe doing the ibuprofen, the hot, the cold, whatever's. I'm just wondering, are they waiting too long? Because it always has struck me as, why didn't you come in sooner? Right. But like, is that an unrealistic expectation I'm having, or would you recommend that they be see sooner?
I would say be seen sooner, right? Understand what's going on. I mean, also because I think it's reasonable for, a few days, a week, try some things on your
Hmm.
own, see if it gets better. Some things will just get better within, a week or two, or you start to notice patterns, right? It
Hmm.
is actually a little bit easier for me that if something's been going on for say 2 weeks, or
Hmm.
3 weeks compared to like this started yesterday, it may actually have a
Right.
little bit different of a presentation and it's kind of going from acute phase to maybe more subacute, right? If it's still happening
Hmm.
in kind of that subacute and now becoming chronic, then like let's really figure out what's going on. I think it's reasonable for people to try a few things for, a little bit of time. And also, I
Yes.
mean, probably in most parts of the US and most practices, right, you're not getting anywhere next day. Right?
Right.
There's just they don't have that availability. So people might go to an urgent care, get an x-ray, x-ray's normal, they're told kind of the same things they would probably be trying at home anyway.
Hmm.
But those things that you're mentioning, kind of the adhesive capsulitis, the other injuries, especially that we see perimenopause, menopause time frame, those
Hmm.
do have those do tend to be more chronic conditions that
Yeah.
can either wax and wane or they've been going on for a while. And a lot is due to the hormonal shifts that happen.
Hmm.
And during that
Hmm.
time, the loss of estrogen, that plays a huge role in joints and muscles and tendons as we're kind of
Hmm.
going through those years. So kind of understanding that that has a role, but also just knowing that there are things that we can do about all of
Yes.
those that are non-operative, right? And that help to
Yes.
stimulate healing and get them better and get them out of pain. So
Which brings me to potentially some controversial topics. All right. So feel free to field these how you wish. The three things I get asked about frequently are going to be red light therapy for joint abnormalities and pain, PRP, and stem cells. Where is the research at? They'll
yeah.
tell me my veterinarian just did stem cells, my chiropractor can do PRP. Like, what's the down low on all this?
Yeah. So I can tell you from, personal experience and what I do in my practice. I do both
Hmm.
PRP and I do shockwave.
Okay.
And both of those, I think the evidence is really amazing. It kind of again depends on what body part we're talking about. Are we talking about a joint? Are we talking about a tendon, right? And it also can depend on the user, right? And
Okay.
so even when we talk about like ultrasound guided procedures, right?
Hmm.
How that ultrasound will be done or how the injection will be performed or the procedure can highly depend on how good the person is who's using the ultrasound, right? Are
Sure.
they getting it to kind of exactly where they need? Luckily, sports medicine fellowships these days are really incredible at teaching ultrasound, and there's some amazing, amazing musculoskeletal ultrasonographers out there in pretty much every fellowship. So I would kind of think that most people coming out of fellowship are pretty well, well versed in it. But I
And
think
that's the
that's
shockwave you were talking about,
that's like ultrasound guided injections, which
just ultrasound.
PRP.
Okay.
Yeah, when I do PRP, I use my ultrasound pretty much for everything.
Okay.
So
Okay.
PRP, platelet rich plasma, for those of you who don't know, what that involves is when you come into the office, you take a sample of your own blood. You then put it into a machine called a centrifuge to spin it down and separate blood into its separate components: red blood cells, white blood cells, platelets. Platelets are what we are trying to get a really high, like super physiological concentration of. And then when we spin that down, right, if you take, 60 milliliters of someone's blood, that might spin down to, 3 to 5 or 3 to 6 cc's of really highly concentrated platelets, platelet rich plasma, and, plus or minus some white blood cells, depending on what you're doing. And you then inject that back into the area of disease or damage. So that could be a tendon, that could be like a rotator cuff pathology, that could be a partial tear, that could be an arthritic joint, right?
Okay. Okay.
And Shockwave is using a shockwave machine, which uses high frequency sound waves to also stimulate healing. And both of these use the body's natural mechanisms to heal that area, like from a cellular level. And
Okay.
so again, with these, we are talking about promoting inflammation, promoting healing compared to something like cortisone, right? Where you are just reducing inflammation, trying to like quickly fix the pain and then, send them on their way, but does nothing for healing or promoting, inflammation of that area.
So the big contrast is you're actually making the body be more inflamed short term to get long term less inflammation,
Yes.
right?
Yes. Yes. And that's why when I do PRP and shockwave, I really want to make sure people are not taking anti-inflammatories, Advil, Motrin, ibuprofen, anything that can reduce inflammation, because our whole goal is to promote this inflammatory process to help the body start healing.
Now that's gotta sound like totally backwards to people listening.
Yeah.
Help us understand that. Like, why would we do that?
Yeah, because inflammation is actually a good thing, and that's why there's so much controversy about when you get injured and you have swelling, right? Do you take an anti-inflammatory to bring that swelling down? Because essentially when a part of the body gets injured and swells up, it's the body's response sending all of these healing factors to that area and growth factors and all these things and like all these markers that are kind of going off to help bring healing to that area, right? We also know of platelets as, what helps to clot our blood, right? And so
Mhm.
a lot of times swelling can bring a lot of pain also. So really during that acute phase, it can be helpful to kind of bring some of that down. But overall, especially with these chronic injuries that we see that are just lingering and lingering, like the shoulders, the plantar fascia, right? The things that you just hear people dealing with for years on end. We need to re-stimulate that inflammatory process to kind of bring more healing to that area.
Good deal. Thank you for explaining. Because I know if I tell somebody, go get more inflamed to get less inflamed, they're going to be like, who
Yes.
are you talking about? This is craziness.
Yeah.
And so then when that was shockwave and the
Yeah. And
PRP.
PRP. Yep. So good evidence, really good evidence for both of those. Not
Mhm.
enough evidence for the FDA to cover those by insurance yet, which is
Right.
always really frustrating, right? Because it's
Yes.
just the things that tend to heal people the best and promote the most
Mhm.
long-term benefit are not covered by
Yes.
insurance.
Of course not.
Of course not. Yeah. Stem cell, a little bit less out there. Again, I am, I do not do stem cells. And it's, again, I think you just have to know where you're going, right? If you see like an ad in the paper and it just sounds too good to be true, it might be, right? And
Right,
you
right,
don't really know what you are getting. And so I think with the policies and like the evidence on stem cells and a little bit of PRP to that extent too is every provider and every practice probably does it a little bit differently. And so there's no standardized protocol, which makes things a little bit harder and makes it obviously a little bit harder to study as well, because it is, there's just like, has not been that much standardization. And I think that's kind of the
right.
challenge with it.
Mhm.
In the sports medicine world, I think there's just some amazing research just about both of those things. And then red light, again, I think sort of similar. I think it's a nice adjunct. I am not as familiar, to be honest, with the research of red light. I do know that
Yeah.
a lot of local physical therapy places will utilize red light as kind of part of their treatment protocol and have seen a lot of really good benefit with it. So,
Mhm.
I'm forward in that
Yeah.
way, especially if patients are getting better. And it's just kind
Mhm.
of part of the treatment protocol.
Okay. Very cool. So you heard it here. These are the ways to go forward. Find your sports medicine physician, get checked out 2 weeks, and then you need to reset. Long term, definitely got to maybe get some inflammation to get better.
That's right.
The other thing, pivoting just a touch, but staying here, is I hear a lot of women ask me, what about collagen and glucosamine and turmeric, these natural herbs and things? And in general, I tend to tell them, look, I can't find evidence of harm. Try it for 90 days. If you feel better, great. If you don't, stop doing it. But from your perspective, what would you say on those?
Pretty similar to you.
Okay.
I would say the evidence is not like out of this world for any of those things. I mean, maybe I think glucosamine can draw in for, arthritic pain can,
Hmm.
some people find benefit with it. But is it like, next level? This is like what everyone should be taking? Not necessarily. Again, and turmeric is just kind of a natural anti-inflammatory that, a lot of people will just use it in their cooking, which is great. Some will take pills, but it may not be for everyone. And kind of depending on how people are responding is how I
Hmm.
respond as well. There are, I don't love when people are on like 50 supplements because it's just like,
Right.
what's working here? And also, how much are you paying for this on a monthly basis?
Right.
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 When really we could go back to some lifestyle behavioral changes that
Hmm.
would help with some of this. Right. And so that's kind of one of my more enjoyable things to do is when people come in with like super long supplement lists, I'm like, all right,
Yes.
let's see what we can cut down on. Right. And
Hmm.
I love, there's a few supplements that I really highly recommend to, most people, but it's
Hmm.
definitely not 50 of them.
Well, tell us what they are, because they might
Yeah.
not be the same ones I'm recommending as an internal medicine doc, right? So tell us what they
Yeah.
are.
So I think vitamin D really important,
Agree.
and I think
Yes.
especially depending on where you live in the winter time, we pretty much
Mhm.
all need to be on vitamin D because we
Mhm.
just don't expose enough of our skin, and the sun is just not out enough to
Right.
really benefit from getting it naturally from the sun. I think
Mhm.
summertime when our arms and our larger body parts are exposed, it's a lot easier that in 10-15 minutes without sunscreen
Mhm.
we are
Yep.
absorbing kind of what we need to, but in the wintertime, we just don't. So
Right.
I think vitamin D, really important. Creatine is another favorite of mine. Especially, I just think over the years, I mean, obviously, this has become such a hot topic, and, creatine's been
Yes.
around for a really long time.
Right.
And also just, a lot of questions about it, but also just
Mhm.
more and more evidence, not only for, muscle health and recovery and everything like that, but for cognitive health as well. I
Yes.
think there's a lot of really important research that's coming out about that. And I just think it's
Mhm.
really cool. And it's also one of like the cheapest supplements out there, which is even
Yes.
better. Um, those are, yeah.
I
because it's
usually cut my my women off at 5 for that. Do you have a
yeah.
different dose recommendation?
No, I do 5 also. I say start
Hmm.
anywhere like 3 to 5. It can cause
Hmm.
some of that like water retention and bloating, especially in the beginning. So
Yep.
just kind of making sure people are aware of that. But and
Right.
then, people always ask about, the loading dose. Should I be taking like 20 at a
Hmm.
time? I am just very much like just start 3 to 5. That's like a really good maintenance dose. If you haven't been on it before, generally can take a few weeks to kind of restore those levels and kind of maintain you at a good
Hmm.
place. And then you
Hmm.
can stay there. And I think that's a really good place to be. I know that some of the studies for the cognitive and the mental health effects are
Hmm.
stating 10. But
Yep.
I don't know that there's enough out there yet for me to
Right.
confidently tell people to bump up to 10 daily.
Yeah, agree, and certainly not starting at 10,
Yeah.
but having a
Yeah.
conversation with somebody who understands the supplement, how it works, always important. Because in fairness, most of our colleagues aren't taught about supplements. That's not a standard medical school curriculum, and so there's a lot of variation and misinformation. But yeah, I
Yeah.
completely agree with you. And I tell my patients, listen, if you want to move to the equator or eat 5 cans of sardines a day, you don't have to take the vitamin D, but otherwise just chalk it up and take a good brand, right? Because we're
Yeah.
not going to get it
Exactly.
otherwise. Okay, cool.
Right.
So I want to
Yeah.
shift a little bit for us and think about women's health if we can. We do have some male listeners, but for our women, from your lens, sports medicine specifically, are there things that women, let's say we'll pick 30 to 60 years old, women in that age range, are there things they are misunderstanding about their body and their musculoskeletal system that you wish they knew?
Yeah. I think some of the big things that I feel like I've been doing a lot more reading and kind of research on all of this stuff,
Hmm.
but I think one, making sure that we are eating enough, right? And I
Okay.
think that for a lot of us who kind of grew up in the era of like we need to be super skinny and we need to,
Hmm.
not bulk up too much. I feel like
Hmm.
women have probably been restricting what they're eating for a
Hmm.
really long time. And I think that that makes us go into a sort of starvation mode if we are not taking in enough calories, right, to fuel our body and the activities that we are doing. And
Hmm.
especially if these women are active and they're working out, even more important that we are fueling our body properly, kind of in and around exercise throughout the day,
Hmm.
not
Yeah.
restricting. And
Hmm.
another thing I think is lifting, right? Strength
Hmm.
training. And I think again, another thing that people were concerned about at, a point in time is getting too bulky, right? And
Right.
you are not, yeah, you are not with kind of the strength training kind of that is recommended. You are not going to, overnight become a bodybuilder, right? Like that
Right.
takes a
Right.
lot of effort. That
You're going to
most people
see it happening.
exactly. So, but we have seen kind of time and time again with the evidence that's coming out is that especially going through those perimenopausal and menopausal years, we need to be lifting heavier because it
Okay.
is protective for our bones, it is protective for our health and everything else, especially as we are starting to kind of lose more estrogen. And
Absolutely.
just holding on to kind of that peak bone mass, right? And preventing injuries and fractures and falls down the line as we get older, right? Because
Hmm.
as we go through menopause, that bone density just starts decreasing and we really need to make sure
Hmm.
that we are holding on to it and staying as strong as we possibly can for our, our physical health, our metabolic health, everything. I
Hmm.
think those are some really big things.
I agree with you. And over the last, I'll say 6 to 12 months in our practice, some changes we've made is we actually have our patients as part of their wellness visit. They do a body composition scan, they
Yeah.
do grip strength testing, and
Yeah.
we're really focusing on how can you get stronger. And this is an early warning sign if you have weak grip strength in your 40s and 50s for what is going to be in your 80s and 90s. And really trying to help people understand like this, these people who fall in our nursing homes and wheelchairs in their 80s and 90s didn't just get there in their 80s and 90s. It's from the
Right.
habits that started in their 30s, 40s, 50s,
Right.
and really starting to have a different dialogue about that. And so, as our ladies that are listening are thinking, oh, I'm not doing anything, where do I start? What are
Right.
3 tips you would give them knowing that over the next several years they can work up to what you're describing, but they literally don't
Yeah.
know how or what to do.
For sure. I mean, one, start slow, right? Because
Mhm.
we, do not want to have somebody get injured immediately if they,
Right.
lift up weight or they do something with improper form. I think one really important thing, so obviously I told you I kind of do like a biomechanics assessment when I'm in the office with them.
Mhm.
But I think if you're first starting out and really haven't lifted or exercised, working with a really good personal trainer,
Mhm.
even just to kind of get started, can be really helpful because you then have somebody who's trained to watch your form, kind of start you off with the proper program for you, make sure you're not
Mhm.
progressing too quickly. And then you can be set free and continue on your own as you know what to do. I think, group classes and gyms are all amazing for, especially for kind of the camaraderie and for the community that,
Mhm.
that people become just a huge part of, but it
Right.
also can bring the risk of injury, especially in
Yes.
that group setting, right? And especially if it's like a boot camp or a hit class where you're
Mhm.
actually lifting and you're doing explosive movements, it's really hard, and I speak from experience because I teach a group class once a week, is when you have a full class, it's really hard to, like, really watch each person's specific form and correct each person's form to make sure,
Sure.
you're doing things properly. You try to do as much as you can, but that I think, it can be hard, so I think having the proper mechanics and form and feeling confident doing those things can be
Mhm.
really helpful to do that before jumping into kind of the group programming and then obviously getting out on your own, which can again just be very intimidating.
Absolutely. And many women may not be comfortable having a trainer who's male and bulked up. And
Yeah,
so looking for
for
female
sure.
trainers, I've noticed even in my own journey, is not the easiest thing to always find. And then
Yeah,
there's different
especially depending where
certification
you are.
bodies. Right, exactly. So,
Yeah,
do you have when you're looking at trainers and all these things that they have that say that they're certified, right?
yeah,
What do these mean? Are they worth judging their training by? At least with a physician, I know if you don't have an MD, you're not a physician, right?
yeah,
Like it's very
yeah,
clear. But when
right.
I have a trainer and they've got all these possible certifications, I don't know where to start.
Yeah, again, I think that the word, like, if you know anybody who's been to someone and can recommend, or if your doctor knows of anyone. So for me, I
Hmm.
feel very lucky that with what I do, I know a lot of really incredible female personal trainers. Some are, specialized more in the youth athletes, some specialize more in that like perimenopausal and menopausal time frame. And
Hmm.
so I luckily know a lot of those in my area. And so I
Yes.
can actually recommend specific trainers to people who are getting started based on also how I think they would vibe, right? And
Yes.
it can also just be worth it. Most people I think will like be willing to at least have a conversation or meet with somebody in person
Hmm.
to hear about their goals. And if they walk away, just like a physician, just like, anybody else, if they don't if they don't have a good vibe and they're like, I don't know,
Hmm.
I'm not sure she understands what I really need, then
Right.
move on, right? Like
Exactly.
don't stick with something that doesn't feel good for you. You want to make sure that if you're going to be paying for something and doing something, you are getting out of it everything that you want to, and that it's, providing you the value and also, you're helping you to achieve your goals.
Absolutely. So maybe your neighborhood sports medicine physician would be a good place to start. I have a feeling that the local Facebook groups are going to be full of information on this as well, because I feel like
Yes.
every
Honestly,
mom
yes.
Facebook group says this, right?
Yeah.
And then I did have another question I forgot to ask you earlier. A lot of internal medicine trained physicians and maybe even pediatricians, our first referral for an injury might not be sports medicine because we don't know about it. It's not in our community, whatever. We didn't see it in residency. But what we are often trained to do and reinforced to is physical therapy. So I'm
Yeah.
curious, can you walk us through? I know they're not the same at all in what you do. I suspect there's overlap in thoughts, though. And, if you were talking to physicians, would you
Yeah.
say there's a difference and a reason to go one way or the other? Give us some advice there.
Yeah. I think it's nice having the formal kind of like diagnosis and game plan from a physician rather than walking into most PT clinics, at least depending on the state, are direct access, meaning that a patient can actually just walk in without a
Right.
script or anything, right? And can just say, I'm here to treat, to treat my knee, right? And then
Yes.
the issue is that leaves it up to the physical therapist to kind of really fully diagnose the issue and then come up with a game plan. Whereas when I write a physical therapy script or like, an imaging script or something like that, I am really descriptive on my script, and similar to personal trainers, I refer to specific people. And so I will actually call them, I will text them, I'll say, this is what's going on. And then even on the script itself, if they go somewhere else, I write, this is the exact issue and this is what I want to be worked on, and like modalities and things like that. So I think that the more specific you can be, probably the more they will get out of it. Whereas if you show up, and your script just says knee pain, right? Then
Right.
it's really leaving it up to the discretion of the physical therapist. And hopefully it's a really good physical therapist, right? That
Right.
will take the initiative to really do, a really full comprehensive workup and figure out kind of where the deficits are and make a game plan from there. Some, just like some physicians who are in the traditional system, don't
Right.
have the time to like do that, right? And so
Right.
if you go to some of these bigger PT places that are seeing, maybe 5 or 6 people an hour, they will be more limited what they do rather than a place that is seeing 1 or 2 per hour and is really spending that one-on-one time.
Yeah, thank you. I meant to ask you that earlier, and I just wanted to clarify that for our listeners and for our physicians who might be listening, or our nurses, because that is something that is just, if you don't explicitly call it out, we get stuck in our
Yeah.
habits, right? And we just kind of do what we were trained or what we see, and it doesn't have to be that way. So I want to take us back to food for a little bit. You were talking about lifestyle earlier, and so I'm internal medicine trained. I deal with, the postpartum, the fertility, the perimenopause population. So that's who I think about the most. And
Yeah.
so many of them at some point have just general joint pain. Their hands are stiff, they feel swollen, bloated, no injury, they
Yeah.
just hurt.
Yeah.
And one of the things we often do is, well, what is your insulin? What is your inflammation? Right?
Right.
Is this related to the foods you're eating or not? And we often will put those individuals on a low glycemic diet if their insulin and glucose are high, or we'll put them on an anti inflammatory diet, which by nature, both of those exclude good foods, healthy foods. We're not talking about those
Yeah.
potato chips. And
Right.
so I'm curious from your perspective, we often see people get better, but not always completely. And from your perspective of nutrition, what are things that just the general aches and pains of life, what do you tell people to do when it comes to food? Or do you not see that because you're dealing with more injury?
No, I definitely see that. And I think that everyone pretty much kind of has, questions on nutrition and what to be eating. And again, there's just
Hmm.
so much information out there. There's so many different kinds of diets and ways to eat, and,
Yes.
all these different people promoting all these different things and
Hmm.
whatnot, kind of like supplements. So I often
Yes.
go back to the basics and,
Was that a
I'd like to
subtle dig
just,
at supplements?
yeah,
That
exactly.
sounded like
So,
a subtle dig there. Sorry to
so
interrupt you.
no, it's okay. So, kind of the American College of Lifestyle Medicine, which is where I did, where I got my board certification through,
Hmm.
really adopts a whole food plant predominant diet. And so
Hmm.
I often break that down for people. I have people do a 3-day food diary just to really
Hmm.
get a general sense, right? Because when I have somebody here in the office, I'm like, all right, what does your general, eating pattern look like? Breakfast, lunch,
Hmm.
dinner. And most people will be like, I eat pretty well, I eat pretty clean.
Right.
But it's like, I need to know details, right? And like, I want
Yeah.
to know, what are you actually eating and drinking throughout the
Right.
day? So I have them keep a
Right.
food diary and try not to make any changes. But obviously, like, if you're keeping
Hmm.
track of something, you are invariably going to probably
Change
already
something.
eat a little bit differently.
Yes. Right.
But anyways, it just gives me a better sense of like, are you eating, chips every day at 4:30 because you are,
Hmm.
somewhat crashing and you just need something to bring your blood sugar back up to kind of
Right.
get to dinner, and then you eat too much at 4:30 that now at dinner time you're not really that hungry, but then you snack again at 8 o'clock.
Mm-hmm.
So I look at general trends, but I also look to see kind of what people are eating and are they incorporating and really kind of adhering to mostly a whole food, plant predominant diet, and meaning whole foods, really just like eating the food in its most pure form, right? And so I
Mm-hmm.
always give people the example of when you go into a grocery store and you're shopping on the perimeters, that is where you're going to find the produce, you're going to find the things in their wholest purest form, right? You pick up an apple, that's what you're eating, right? You are eating an apple. There's nothing that they're hiding inside, unless
Mm-hmm.
there's like a worm or something like that. But
Please, God, no.
hopefully
Don't
not.
do that to me.
Right. But then, if you go into those center aisles, you start finding how those types of foods are broken down, right? That apple can become applesauce. And yes, some applesauces are better than others and really just have apples in it, but then it can become apple juice, right? And each
Mm-hmm.
step of this process and like the processing chain is adding more things in it to preserve it, to let these things last
Mm-hmm.
forever on the shelves, right?
Mm-hmm.
And
Yes.
these added sugars, right? And so that's another thing that I talk about is added sugars, right? And how added
Yes.
sugars are different from natural sugars, right? Our
Mm-hmm.
body understands what it can do with natural sugars that are found in, fruits, veggies, even, bread, right? There are natural sugars found in that compared to, Oreos and, fruit by the foot, where they're adding in things that
Right.
just doesn't make sense
Mm.
to our body, and then our body gets inflamed from eating that kind of stuff. So I always go through label reading with people,
Mm-hmm.
and like when I give talks all over, like I'll show examples of certain labels and I'll be like, these things are marketed as breakfast foods, and it's like, can you
Right.
guess what they are? And the labels are like paragraphs long. You can't understand
Yes.
what's in there, you can't pronounce it. I usually try to have people guess the food based on what the ingredients are. And,
Mm-hmm.
but the government and, we have unfortunately gotten very good at marketing. So if you
Yes.
aren't really well, versed in reading a label and understanding what's going in, it's totally confusing. So
It is.
it's kind of
And
teaching those
overwhelming.
basics, right? But also,
Absolutely.
like 80, that should be 80% of the time eating clean, right? And then
Mm-hmm.
20% enjoy life, right? Enjoy the
Right.
birth, like go out to eat. Don't worry about every single thing that you're consuming, because that totally takes the fun away from life and like the enjoyment of food in general. So
Right.
just understanding
Yeah.
kind of what the basics are, but still enjoying it.
Okay. I love it. I also am lifestyle medicine trained. So what you're saying is my vernacular is all the time.
Yeah.
And the number one pushback I get, and I suspect you might too, especially interestingly from my ladies, is how can I eat a plant-based diet and get enough protein?
Yeah.
What do you tell them?
It's
Good luck,
hard.
bye.
Yeah.
Right? It is
You're
hard. It's
gonna
so hard.
It is really hard. And I think the reason that I say predominantly plant based is because I do believe that good sources of animal foods are really healthy for us, right? We know
Hmm.
that salmon, really good for us, right? Is it
Right.
preferable to be wild caught? Sure. Yes, it is. But like, if you can be eating, salmon or like a really good fish, once a week, and then like
Hmm.
eggs also probably like the most controversial food out there.
Yes.
But if you're eating
Yes.
good quality eggs, and that includes the yolk also, which has so much
Yes.
benefit, I think those can all be part of a healthy diet, right? And it's, again, we talk about things in moderation. It's like, do I want you to be eating 5 eggs every day for breakfast? I don't. And
Right.
and variety is good, but having all of these things be part of what you eat, and hopefully good high quality sources, is important. So I mean, I think if people are vegan for a specific reason, then like we definitely need to figure out how they are going to get their protein, because yes,
Hmm.
that can be, you can be eating just like a lot of tofu, tempeh, lentils, beans, flax, chia, just adding it to everything. And then they might also be incorporating some protein powder in there just to make sure they're kind of getting enough.
Right.
It's, I would say protein goals are challenging in general.
Yep,
And it's like
absolutely.
something to be so conscious about. But
Yes.
it's doable.
I just wanted to point that out because that is, I think, probably the most frustrating thing to patients that I have over the years told them is they're like, that's great, but how do you expect me to do that in real life? I'm like,
Yeah.
I get it because I'm trying to figure it out in real life
Yes.
too, right?
100%. We're all there.
So,
We're all there.
yes, yes, we are not the elite figured it out group yet. If we are, we'll let you know and you can join, but we're not there.
Yes.
We're trying to figure it out too. So
Yeah.
this has been just so delightful talking to you. Before I let you escape, I have a couple more questions. Number one, what advice do you think women get that is really harmful to their musculoskeletal system? And then number two, what have we not talked about that you want our women to hear?
Let's see. That's a good question. What advice is harmful? What I do think is harmful is doing like really high intensity workouts every day.
Okay.
And not allowing time for recovery. And I do think that kind of a lot of people kind of can get into that kind of routine because like if the
Mhm.
gym they belong to is just like super high intensity and you're doing that 5 times a week, our bodies don't recover as well from that, right? And just
Mhm.
like food, we need a variety of what we do. That keeps our body guessing, that keeps our body from not breaking down, and we need the recovery on the other end of that, the nutrition, the sleep, the different types of movement to complement how we are feeling. And I think a lot of people are like stuck like doing the same thing every day and they're just like, why am I not getting stronger? Like, why do I feel like I'm just like getting injured? Things are hurting. And it's like
Mhm.
our bodies aren't meant to, like, especially at this age or as we get older, to be doing this every single day, right? And
Yeah.
I definitely learned that too late in life. And I'm now, practicing more kind of what I preach. But I was one of those people, right? I was working out super high intensity, 7 days a week. Like I was just,
Mhm.
I hated days off, and I now have really come to appreciate them. And I feel like I'm able to better explain that to my patients, having, really learned and kind of gone through the
Yeah.
process myself.
And lived it. Yeah, absolutely.
Yeah.
That's helpful. Thank you. And
Yeah.
then what have we not talked about?
What have we not talked about? Talked about shockwave, talked about PRP, talked about the importance of sleep. I think stress is another big one.
Okay.
Um, and I think that especially in, that female 30s to 60s, there is a lot going on during that
Yes.
time of life. And I think that if we are not taking care of ourselves and not realizing kind of how much stress we are under and how much, like we are shouldering and taking on,
Mhm.
I think that can have really detrimental effects on our musculoskeletal system, but the rest of our life also.
Yes.
And I think that's really something important to see. There's luckily like a lot more talk now about, nervous system health and,
Mhm.
trying to get out of that constant fight and flight and kind of reactivate our parasympathetic system. And
Mhm.
it's kind of really exciting to see where all that's going. And I hope that more and more people will hopefully kind of get out of these cycles that we have found
Yes.
ourselves in, to just come out for the better on the other side.
Absolutely. Create their own story, one step
Yep.
at a time.
Yep.
Everything, can be figured out, as you said earlier.
Yeah.
But it does take a ton of attention and effort to break
Yeah.
from some of these cycles. So, thank you so
100%.
much for being here and for sharing your wisdom with us. If our listeners want to find you, what's the best way for them to do so?
Yeah. So Instagram, I'm at Dr. Sassy Weinstein. My website is coresportsmedicine.com. Facebook is Core Sports Medicine and Lifestyle Medicine. So feel free to reach out, ask any other questions. I post some cool stuff on there like 5-minute workouts and, other myth busters and other fun stuff. So looking forward to kind of
Love it.
connecting with anybody.
I love it. Well, I definitely need to make sure I'm following you because that's stuff I need too. So thank you for putting that out there and sharing it with us. And for our audience, if something in today's conversation resonated, it's because you're not alone and you're not imagining it. You can find more support and resources, next steps in the show notes. If this episode helped you feel seen and validated, please share it with another woman who also needs to hear it. Until next time, we'll see you on the Authentic Physician. Bye.
Bye. Thanks so much.